What way can I dye my hair during pregnancy? They say you should avoid anything unnatural and even a lot of over-the-counter drugs, so where does hair dye fall in that spectrum?
The stereotype of the crazy old lady is thought to come from all the curl relaxers and perms they use over the years.
I'm just thinking of a touch-up, not a fancy perm.
Hair dye doesn't really get into your body if you use it correctly. If you dye your own hair, use gloves.
I usually go to the hair stylist for the dye job.
Go for a minimal dye job so that the dye is in your hair as short a time as possible. Then rinse your head as soon as possible.
I've heard you shouldn't do it while the baby is growing.
As with all developmental defects, the danger is greatest in the first trimester. If you have concerns, don't get your hair dyed until the second or third trimester.
I've heard people say pregnancy messes up hairstyles.
The hormones affect everything from your skin to your hair. Because of the texture changes while pregnant, you could get a different tone on the newer hair.
Then I'll have to tell her to stay away from my scalp.
Or dye the hair your natural color and leave it alone for until after the baby is born.
That's a radical change.
You could consider it going au natural.
Except that I'd look totally different.
You're pregnant. That's to be expected.
I could avoid the hair dyes with ammonia, since that is toxic.
How do you know?
I have a list of cleaning chemicals to stay away from. And ammonia is in some professional hair coloring products.
Going back to your natural hair color has another advantage. Then you'll look fine even if you don't have time to dye it after you have the baby.
That's what I'll do when I need time away from the baby.